Real honor to be here, everyone, and thanks very much for inviting me. Thanks to Deborah, and very excited, a little bit nervous, like one of the other speakers, not often speaking in front of a patient group. So, but I'm really happy to be able to talk to you today about some of the things that I do in my current role and some of the things that, that I've done in the past as well. So to start with, actually, I didn't realize I was going to have an intro, so I was going to do a little bit about me. I hope those slides are coming through okay. But yeah, as Deborah said, I'm a pharmacist by background. As you can tell, I'm Irish. I moved across over to the UK to study, and the first picture here is the University of Manchester, which is still really close to my heart. So I studied pharmacy there, but then once I graduated, I moved down to London. And these are some of the examples of the hospital I worked in. So we got Bart's in the middle and then the Marsden on the bottom. It was pretty soon after graduating that I got into oncology, and mainly in solid tumor oncology. So primarily focusing on breast and then lung cancer. And it was in 2019 when I made the move into pharma, and I've been with Pfizer since then in the role of medical affairs. I started off mainly working in the breast cancer side of it, but around about a year ago, an opportunity became available and I moved into the lung cancer field, and I still had a bit of expertise from my days in the NHS. But it was around that time that I got to know Deborah. One of the first people I think I met when I moved into role was Deborah, and I'm glad that it happened because we've had a pretty productive relationship since, I think. And that's what I'm going to come on to talk to you today about. So, working together. What I want to do, basically, is I'm going to start with talking about why I think it's important to work together between pharma, patient groups, patient organizations, but also the NHS. I'm going to go a little bit into the how. It's pretty boring, but it's still important, I think, to be able to tell you what I can and can't, or how we can and cannot work together. And then I'm just going to go through some examples of what I've done, some of the work I've done with ALK Positive, which I think is a fantastic group, some of the work I've done with other patient organizations in my role in Pfizer, and then I'm also going to talk about some projects that I haven't been directly involved in, but I think you'd still be interested to know about how to get patients more involved in clinical trials in the UK. So I hope my slides are coming out okay. It might be a little bit difficult to see, but I will go through them anyway. So first of all, the why I think it's important to work together. This particular slide actually borrowed from Deborah when she came to speak to some of us and my colleagues in Pfizer a few months ago. I have adapted it somewhat, but I'll just go through some of the different reasons why I think it's important we work together. So starting at your top left, I think pharma can be obviously very corporate, but I think we do have and do try to show some shared values and a shared agenda. So you'll see at the bottom of each one of my slides, breakthroughs that change patients' lives. That's Pfizer's purpose, so to speak. That's our core aim. May call that a little bit cheesy, but when I was trying to prepare for this presentation, I went back to that level and I saw, okay, so that's our core purpose, and then I saw support, empower, and advocate for patients. And obviously, the one thing that was common to both of those is the fact that patients are at the center of it. So that's a really, really good foundation, I think, for any relationship to try to build it and to take it further. Second one down in the middle then is all about the shared agenda. And I think we've had some great talks already today, which just give countless examples of where this shared agenda might be. So access to medicines, for example. We really had a nice talk that just preceded this one about different medicine and what should be available. I think we'll all agree, wherever it's available, we all just agree that the more medicines that are available for patients in the UK, the better. But then there's other topics, such as, I think 2 talks ago, we were talking about the need to have an educational focus. There's a great need, especially that this group has recognized, for educating new patients diagnosed with ALK positive lung cancer, but also families, carers, even maybe not the experts at NHS level, but the new junior doctors or junior pharmacists or junior nurses coming through. There's a great need there to educate, and I think pharma can play a really important role. And I'll come on to that on one of my next slides, how that can happen. And then also brain mets. We've spoken a little bit today about just the issue and how important it is for the health and the problems that happen if you do end up progressing in the brain. And we've had conversations about this. It's almost too big an issue for one group or for one organization to solve. So there's great work that ALK Positive are doing, but there's definitely a role that pharma can play, whether that be support, lobbying, whatever it might be. And that's something that we've had discussions on before. The next one, then the bottom, is all about co-creation and it's content, essentially. Pharma will create tons and tons of content, some of it valuable, some of it not valuable. But what we've tried to do is come together to understand and learn from patients on what is good educational content, what is content that is needed, and how we can help to help create it. On the other side, then, it's a little less clear cut, I guess, but I think that still equally important. So we have reputation. Of course, Pfizer's reputation around about 18 months ago was probably the peak of how it had ever been. But there's no denying, I think, that there's definitely a reputational piece to be done, and we put a lot of time and effort into this. But by working with patient groups, I think there's a way we can improve it. But then the flip side of it is, especially some smaller patient groups, there can be a reputational gain for working with a large-scale pharmaceutical company. Resource, whether that be financial, people, expertise, I think there's a great need for us to share resource. And then reassurance, especially for some of our newer medicines, for example, coming through. It is a tricky time for all people to understand. And we are, I guess, the experts on how to use a medicine safely, how to communicate information about that medicine. And we have medicine information departments which are available to help. But then equally, the reassurance from the other side, if we or my team and Pfizer decide that we're going to embark on this particular type of strategy, having a word with an expert in your group is really, really valuable to know whether that strategy is the right thing that we should do, and is it going to be actually beneficial. So in terms of the how, so Pfizer is part of a group called the Association of British Pharmaceutical Industries. Essentially, this is the body that self-regulates us. This is the body that we have to adhere to our core principles. You can see these on the slide. So the number one core principle of this group is to benefit patients, to always act with integrity, transparency, and to overall have respect. Saying that, we have this separate set of guidelines called working with patient organizations, and it can't always be as clear-cut as we would like to go out and do everything we may want to do. One of the key underlying themes about this is the principle of sharing information in relation to our medicines. It's very, very clear in this guidance that we can talk to healthcare professionals or we can talk to policymakers about our medicines, but there's for example, we can't promote directly to patients or to patient groups, which is a good thing. Otherwise we'd be, I guess, like they are in the States, where you can see cancer medicines advertised on billboards or on television adverts, which I think is maybe a step too far. So that's the why and the how. I'm now going to come on to talk about some of the work that I've done, and you may recognize some of the people on this slide, because I've had a real pleasure of working with many of the people in this room over the past 12 to 18 months. It all started, as I said, with that phone call when I first came into role with Deborah, and the next step really was we organized an advisory panel with 8 members or family members or carers of people in this group. And essentially we ran an advisory board, and this was back in October 2021. And really the purpose of this was to help understand what's happening that's good, what's happening that's not so good on the ALK Positive pathway within the UK. So we want to hear it from you. We acknowledge that we don't have any of the answers, so the first place to go is to try and understand from people who are going through that story or going through that journey and understanding where the pinch points are. We had that meeting, and one of the first things we did was we explained what it was we found. So the first 2 things up in the top left corner are a poster that we took to BTOG, so the British Thoracic Oncologist Group, to present what we found and what we understood, but then also we present it in a more patient or person-friendly format, someone that isn't maybe as used to or doesn't get the opportunity to attend these type of scientific conferences. One of the main things we found from this group, which was a really, really useful and I think enjoyable experience for everyone who was part of it, was that education was key. So as I was saying earlier on, there's a big gap for educating people in this group, or people who have not yet made it into this group, but as well as educating junior healthcare staff in the NHS. So some of the first stuff we did was create some educational videos. So shout out to Andy and Lynn, as you can see up there, who helped us create these 2 videos. And these are essentially, one of them was just about a video briefly describing what it's like to be diagnosed with ALK positive lung cancer in the UK. And then the second one was just delving into that brain metastasis issue a little bit more and trying to understand, what it's actually like to be diagnosed with brain metastasis and what it means for your daily living. So we created those. They're done, and they're available on our website, and hopefully soon to be available on your website as well. But the next thing that we've done is we're speaking from that group again, and we understood and we heard that there was still a need to create a document that will help patients when they're at that point in front of the healthcare professional at the early stage of their journey. So that's what this middle one is, the Good Practice Guide. And we're currently working with Duncan and Lois in the group today to try and finalize that. And we're at a pretty advanced stage, and hopefully that will be something that will be available for all of you soon. Another big part of what we've done is this shared learning and this wider reach. If we come together, we'll be able to impact more people. So as I said, top right is here is when Deborah came in and spoke to us in Pfizer. But also, as mentioned, I'm on the exec committee for the BOPA group, the group of oncology pharmacists in the UK, and our annual conference is coming up in a couple of weeks. And Deborah's going to come and speak to us there about how oncology pharmacists as a whole could have made the journey easier for ALK patients. So this is just some of the stuff that we've been doing, and we're going to continue trying to do initiatives like this going forward. So thanks everyone for the opportunity to help. I'm then going to move on to a different project called the Cancer Insights Panel. This is something which I'm not leading, but it's been led by a group in Pfizer called the Patient Experience Team. And they're actually part of the commercial organization of the business. But essentially what they've done is they've tried to set up a panel to do something similar that we did in the advisory panel purely for ALK, but they're trying to do it on a wider scale across the UK, across all cancer indications. This piece of work started around about 2 years ago in planning stage. Patients were involved in the planning. And essentially what's been set up at the moment is, I don't know if this is turned off. Can I do page down instead? Oh. Yeah. So I'll go to the next one, actually. So what's actually been set up is a journey. We have 40 patients. We have 2 groups, one from the north of the country and one from the south of the country, who meet roughly every 2 months. We've actually just, we're actually now on the second bullet point, the awareness and pre-diagnosis stage. And we just held our second meeting up in the north, and it's trying to understand across the board how it is that, again, where are the pinch points and where are what is working well, but what is not working so well across the cancer journey in the NHS. So some of the things, for example, that came up on that first one was when patients enter that 2-week wait, there's all of a sudden they're told they're on the 2-week wait. They don't really understand what exactly is involved with the 2-week wait. They don't really know who to go to. They're just told that they might they'll hear from someone in due course. And obviously at that stage where you know you're on this pathway, but you're not sure why or you're not sure what, can be quite a worrying and concerning time. So that was just one of the examples, but we're going to be following this over 2 years where we're going to go through each of these stages. We're going to gather all of these insights, and we're going to see some of them Pfizer might be able to help, some of them Pfizer definitely won't be able to help, but at least then if there is some kind of insight that we can pass on, whether that be to government, whether it be to NHS, whether it be to patient groups, that information is not going to go lost, and that's something which, you know, we're looking forward to going on that journey with all those patients. The final project then that I want to talk about is one that I haven't been involved in at all. I've done very little hematology. I'm sorry, my slides probably are very difficult to see, but it's all about clinical trial design. Essentially what happened with this particular project was some of my colleagues involved in a disease called multiple myeloma had a new therapy which is about to come to the stage of opening the clinical trial, kind of like the discussions we were having earlier on. About the next ALK treatment in the UK, when's it going to be coming? But what was really nice is that my hematology colleague Luke in the medical affairs team in the UK was able to get involved at a very, very early stage. So that he was able to hold, again, a panel, an advisory group, involving patients, involving UK patients, where they met. I think they had 6 patients and 2 carers. They met over a series of 3 separate, sessions. Before each meeting, patients were given a little bit to read, a little bit to understand why it is you're here, what type of questions we're going to be asking, and that sort of stuff. And the purpose was to try and help with the design of that clinical trial. How is it going to be relevant to the UK? How is it going to be relevant to that particular patient group? So the type of questions they were going to ask. So, for example, they had a broad experience of the people who were involved, people who did have previous involvement in clinical trials. So, for example, patient experiences in clinical trials. Where do you go for your information? Do you go to your healthcare professional? Do you go to Google? Or what other websites might you go to? Things like study design. Are you going to have to go into hospital every 2 weeks? Is it going to be an oral tablet, or is it going to be an IV infusion? What other trial logistics are around? So like Alistair was saying earlier on, his centre is pretty remote, not much public transport. Is that going to be logistically possible to run this particular type of clinical study? Also understanding things like digital and telemedicine. So, is there a gap? Should we be doing something app-based? Should we be able to record our symptoms on an app? Should you be able to just report them back in every time you visit the oncologist or the nurse every month or every 2 months? But one of the other things that they looked at was all about patient-reported outcomes. So 2 talks ago, we were talking about the importance of quality of life, and now it shouldn't just all be about whether a treatment works, drug A over drug B. It's about how the patient is feeling as they're going through the particular study. Trialists and clinical trials in the UK are getting better at including this type of information, but there's still very little patient involvement in what type of information should be included in those patient-reported outcome questionnaires. So what questions do you include? Would you like it paper format? Would you like it electronic format? What's best? This was all done in collaboration with the National Institute of Health Research as well, and it was great that they were able to get involved at such an early period. So now the insights have come in, the trial designers and Pfizer are now going back, taking that information, and when the trial comes to open, which is sometime next year, we'll have had that input from patients. I have to admit, we're really far away from this being common practice across studies in the UK, but in Pfizer as well, I think. But it's nice knowing that we've had this example, and now there's something that we can all reach towards to make sure it happens all the time. And that is the end. Sorry about my slides. I'm not sure they were very visible, but yeah, happy to take any questions. Thank you.
Stunned them into silence. No?
Yeah.
Yes?
Did you keep going in COVID, or just kind of your area just kind of
No, we kept going. So research and clinical trials did definitely get quieter as we heard earlier on, but other areas picked up. So for example, I think we had a case earlier on about a patient being told to stop their treatment during COVID. So there was a lot of information that we didn't have that we needed to go off and figure out what the answer was. So there was a big worry amongst the oncology community: was it safe to continue TKIs or chemotherapy during COVID? So we were busy kind of trying to answer those questions. Yeah.
This is something that's been done by Pfizer to try and involve the patients in the design, the trial design thing. Is there any consensus among pharmaceutical companies in general about doing this, or is this just a one-off from your own company?
So that example is a one-off from us, but I think there is a growing consensus amongst pharma companies to do more work like this. We don't talk to each other enough, though, pharma companies either. We're enemies or competitors, I guess. So someone could be doing this. I'm sure other companies are, but I haven't seen it as of yet.
Okay, no more questions? Right, thank you very much indeed.
Great.
Thank you.
Thank you.
Colm.